Hi, this is Asan. Today I'll share one of my case study. I got it from Career Foundry. And for this case study, I have specifically choose healthcare industry. So why I have choose healthcare industry? Because I have previously worked for healthcare industry and I found that elderly patients found it too difficult for them to manage their health related activity. My mother is also a patient of the healthcare I've worked for, and I use my mother sometimes to get her appointments, get her medications. So I have seen that though they have an app for their healthcare, but she don't even know how to use it. She don't even use it because she feels it's like useless. But so I have thought that is there any way I can make it useful so that people can manage their health related activity using this specific app. So here I have tried to discuss. I've described shortly in the homepage that why I have chose this healthcare industry, and in this project I have tried to integrate AI because I found it's too easy. User can use their prompt, they can give prompt using the audio, and AI can help them easily getting things they want to get. So after deciding I will work for healthcare industry, then I have talked with elderly patient. I love to talk with patients, and then I have talked with the patients. My task was that I will talk with patients, and if they found any issue, what's how's going there every day, how's going their health. This is the thing I did in the healthcare. So for this, I know lots of elderly patients, and I have talked with the patient, and I have found their goals, what they want to do, and what their pain points. And from there, so their goal was like they want to, most of the people, they want to independently manage their health related activity. They don't want to depend on others also, because in New York City, most of the people, they independently live their lives. So elderly patients also want to do their activity independently, and the pain point is that they found the um, website is too difficult. Specifically our website, the healthcare I work for, I myself also don't use, and I have seen one day and I found that lots of opportunity for working in there. And there another pain point is that insurance activity, because there's lots of insurance, and some insurance, some provider, they don't accept. So for this, though they um, try to make appointment with specific provider, but if they don't take their insurance, then maybe they can see, but they need to pay by themselves. But patient don't want to do this thing, they don't want to pay for their uh, visit. So the opportunity was like, if we can simplify with clear visual and culturally familiar language, like the language they want to talk, if we can make it easily, so they can feel the whole thing is control of themselves, they can feel it independent. And as we have the AI, we can make it like for bilingual assistant for them, and they can, AI can do everything for them if they can just give prompt using audio or text if they can. So talking with them, I have defined the purpose, that the problem that user want to uh, don't want to feel confused or frustration. They want the problem is that they don't know how to use technology. Some elderly patients, they know how to use it, but those who don't know, it's too tough for them to use the technology. Specifically, if I talk about like telehealth or video health, so for now we send telehealth, or for video health we send link to their phone number, and then they need to click in there, then they go to the side of this video visit, and then they connect with um, provider. So it's tough for some elderly patient, and how might we make it easy for them? This was my intention. So talking with the patient, I found lots of inciting incident, like they find difficult for telehealth, like specifically for video health visit, and they often forget medication name is one of the biggest issue. And when we also confirm any appointment for patient, we tell them, please bring your insurance, ID card, and medications with you. And patients often ignore that, say that no, I don't want to bring medication with you. Who will bring medication with every time. They don't want to bring medication with them, and then doctor also don't know which medication they are taking and how the doctor will suggest them the medications for later. So it's one of the problem. And difficult getting appointment, like for getting appointment need like it takes in some facility takes 2 month 1 month. If the patient has emergency condition, they have the uh, emergency opportunity, but it's too tough for elderly patients to navigate those opportunity. Besides, language barrier is one of the most important barrier. Though some people speak English, but in English they also speak with different variations. For those who speak Spanish, for specific Spanish, if they don't get from other, then they feel that it's a new language. So lack of knowledge of changing PCP. Without changing PCP, they don't user patient don't able to see any internal medicine. And though it's easy thing for changing PCP, they can just call insurance and they can change PCP. But for this, they need a specific amount of information like NPA number, other some information, but they don't have and they don't get. And without coming to the facility, they don't get the information and they don't know how to change the PCP. And confusion about test preparation. Some test has specific preparation, and as patient don't know. So though they don't want to do the test, so for proper preparation they can't do the test. So from all the incident and knowing users problem and goals, I have did the wireframe where I have at first I have decided designed this homepage where I've kept like visit statements, records, tracks, messages, and medication, and then upcoming appointment in there. And in there, I have put the AI assistant for help. They can just click the help, and then they will fill this page. They will get those page like for assistant. They can prompt in here, and by this prompt, then they will get this information, and one by one, then they will confirm any appointment. So after this prototype, then I after this wireframe, then I did this prototype for doing test. And for this test, after doing this test, I got some major issue like users struggle to find and book doctors efficiently. Efficiently means the way the uh like those information, like those are thing like there's one more doctor which one they will accept. They don't know, they don't have enough information. Like John Doe is a doctor, so which types of doctor he is and what is education and what is experience, the doctor don't know. And then they feel it's a little bit confusion that confirm appointment with this doctor, will this doctor be good for him. This kind of information is lacking, and then they find struggle. And they want to search specifically for a doctor. They want a search option, clear visibility of available dates. They want to find it clearly visible. And then they want detail of doctor's informations to make confident decision. And in this prototype, worked well is like for describe the AI assistant, helpful personal assistant. AI worked for them as a personal assistant, and chatbot guided them smoothly through tasks. User felt healthcare interaction more simpler for this AI. So from this prototype, the design gap was that user need to get search option, and only available dates should be shown to reduce confusion. Like there will be only they want to get that there will be only available dates, and user want more details doctor information profile. Video commands would help, voice command would help the AI feel like health assistant. They want to get text assistant text command along with voice command. Like if they say that please make an appointment for me with this specific doctor, like make an appointment for me, Dr. X. This kind of voice command will be for more helpful for them. And improvement hypothesis was from my side that build voice assistant hands-free support for hands-free support, and make the AI assistant more visible in central experience so that they can feel it that it's AI and they can use it, and clearly explain the AI in onboarding sessions. Like we will clearly explain how AI will work and how it can help them making their important task in onboarding session so that they can understand and they can have in their mind that this is the way AI can help me so that they can perform those tasks using AI. And for video visit, if it if we can make it uh, in this app, like not just provider will send a link and then we will click and then going outside we will do video visit, not in this way. If we can send, if it's a link we can send it this app, or in any way we can make it inside the app, then it will be great for them. They don't need to uh, interact with other windows or other apps, or going to the other site. And then there is another important thing is that when user will create any appointment using this app, ensure that user is creating app ensuring all of the requirements of the provider along with the patient's insurance informations. Like if Medicaid or Medicare is active, then we are making appointment for this patient, because sometimes patients make their appointment, their Medicaid is not active, they see the doctor and then they get the payment receipt. If they don't want to, most of the people don't want to pay for the appointment because they think that their medical will cover those payment. So after testing that, there's my testing report. I have tested with 4 people, so I have asked those questions to complete in this prototype. And for first question it was like book an appointment and download the appointment confirmation. It was 100% pass from all of the test user. And schedule an appointment with endocrinologist provider, so that was also passed by 100%. Like 4 people tester did it confidently. Then make a blood work appointment for Friday morning. 2 people didn't, 2 people didn't do it. So by this way I have tested the major question. And my iteration is that I tested AI assistant with the people and get feedback. And my iteration is that I will design the app. It won't just looks beautiful and more interactive and modern, user can interact it. And specifically its healthcare industry, trust is more important issue because user have to put their informations like insurance, their ID card, and they will also like there's lots of informations like HIPAA is an important thing in their HIPAA violation. So if user don't put those information, then they will not get their provider won't able to see them. But user have to feel that if they put those information there won't be any violation. So I have put it in this way, like more clear, and user can click and they can do their task easily from there. And AI, I put it in here very um, in the front page very clearly, so that user can just take help of AI. It is talking with them, they will click and they can get the help of AI from there. And from there users feedback was that confirmation page made should be very visible and clear. So for confirmation page I just made it a page in there so that they can feel that their confirmation has confirmed. And future improvement based on the user feedback was that strengthen the conversation flow, clarify task intention, doctor selection flow, accessibility and readability, and feedback and error. This is one of the most important thing, that feedback and error. Like they have done a mistake and they don't know that which mistake they did, and they can't confirm the appointment confirmation. It's one of the most important things. So I have decided that For any mistake, I will say that this is the mistake you have done and do this way so that you can confirm your payment. So testing feedback, what worked well? Specifically, if I say that participant found interface easy to use, my iteration, after iteration, the interface user found it easy, and AI is a supportive personal assistant. And chatbot helped user navigate healthcare tasks more confidently. Clear layout and familiar icons reduce confusion among elderly patient. Those are the things worked well, and what didn't work well. Like some user found the AI responses slightly slow and wanted verify links for trust, and participants struggle to find doctors quickly due to limited search option, and confirmation felt overly complex. And then I made it like very uh, clearly in one page. I made the confirmation page. And what didn't work well, that user wanted to directly connect with the healthcare staff when facing an issue, like they are finding an issue, so user can directly contact with the healthcare medical assistant. And future improvement is there's lots of way to improve the app. Specifically, if I say that found that AI is helpful and describing it as a supportive personal assistant, and we can make it like more smooth, especially for elderly ones, making experience feel simple and approachable. AI, the page will be not that much interactive, but it will be easy so that user can use it easily. And redesign homework, so homepage. So at first homepage was a little bit like modern, then I the feature improvement, I can make it more in there. In homepage I make it more easy, like they have search in tracks, they can track their healthcare information, but user wanted to make it, they wanted to search it from here. So for future improvement, I can make the search page search icon in here or in any way in bottom bar, so that user can easily uh, search what they want to get from there. And my personal learning was that don't design a design just for make it nice. Design something which will make users problem. Specifically for elderly patient, is very important because they don't know how to use the technology, so they need to complete their task, make it in a way so that they can make their task easily. So for this, listening very carefully what's their problem, and then sketch ideas on pen and paper, and then start designing, not just start designing at first glance. And then create an environment where users feel comfortable sharing their true thoughts, not just pushing pricing your work. So while I'm taking feedback, not in a way that I am I have done something for them, so prize me. So I have to take like this is my learning. So focus usability over pixel perfect design, ensure user can complete task easily. This is my learning. And onboarding is crucial, so clearly show how the design system works, and build trust following proper convention, so user feel safe sharing information. Build trust following proper convention, so don't take something new so that user find it hard and they don't trust. Use convention so that feel it that I have already done it, so I can put my information in there, there's not any issue. And obviously, before designing any specific industry, know the all requirements and protocols for this industry so that we can work. Like if we don't know any industry standard, then we may can put anything which we won't work for the specific industry. So this is my personal learning from this project. Thank you so much, and looking forward to hear your feedback. Have a good day.